Hello, this is Stephen Smith from GP Core Content. Welcome to the first episode of the OSCE preparation course I will be running over the coming months. This episode is an introduction to OSCEs with some general tips and advice. I have been working in general practice for almost 25 years. I have also been an examiner for the RACGP OSCE exams. I have been involved in GP registrar training for the past 5 years. In my practice, I use an OSCE case at the start of each session, which is related to the study topic for that week. I find using an OSCE case gives the theory some clinical context, and the registrars can see how this translates to a general practice consultation. I believe OSCEs can be used regardless of the level of experience of the registrars. I think exposure to the OSCE process is helpful even when you're early on in your study journey. The other benefit of doing OSCE cases regularly is that it helps with time management and gives confidence in your day-to-day practice. Today's episode will be general tips and advice for the OSCEs. Each week I will release original OSCE cases I have written with voice-over PowerPoint presentations describing the important aspects of the cases. The OSCE exams are made up of short cases, long cases, and rest stops. There will be 3 minutes perusal time at the start of each station. Short cases will run for 8 minutes and long cases for 19 minutes. There will be a series of buzzers throughout the exam, one at the beginning of each station, then after the 3 minutes perusal to begin the case, then again after 8 minutes. In a short case, this signals the end of that case. You will hand your front sheet of paper to the examiner and proceed to the next station. In a long case, you will have a further 11 minutes left. Do not get distracted by the buzzer, but instead use it to help with your time management. At the start of each case, you will have a set of instructions telling you what is required for that case. It is important to read that thoroughly and understand what the examiners expect from you in that case. The 3-minute perusal time is, I believe, one of the most important parts of the case. If you use this time wisely, it can set you up to do well in the rest of the case. Read the case thoroughly, understand what the examiners want you to do. Try and allocate a rough time for each component of the case, and remember, you can only be marked on the components you get time to do. During my cases, I will talk about the front page. This is the blank page you start with at the beginning of each case. During the 3 minutes perusal, you need to divide the page into sections. You need to find a system that works for you. It needs to be reproducible and consistent. Most front pages I have seen will have 4 sections: history, observation and examination, investigation, and management. Make notes on your front page from the case instructions and pace and history if provided. This will remind you to cover these points during the case. It is amazing how often, in the heat of exam conditions, candidates forget to cover content they had wanted to. When you read the case instructions, you may be able to cross out one or more sections on your front page. For example, if it is an examination and diagnosis case, you can cross out the history and investigation sections. By crossing them out, you are less likely to lose focus in the exam and waste time on sections that are not relevant. If the case says no further history is required, do not waste time asking for more history. This could be the difference between finishing the case or not. With regards to the history, follow the case instructions that you are given. If it is an 8-minute station that also asks for examination, investigation and management, you can't spend 5 minutes taking a history and still finish the case. If it is a 19-minute station, you may be able to spend more time on the history. List on your front sheet what main items in the history you would like to cover. By doing this, you are less likely to forget during the case. You can then expand on these headings during the case. Each case will be different. Some will give you a full patient summary, and other times you do not have any available history, or they are a new patient of the practice. The case instructions may be very detailed and give you specific directions, or they could be brief or vague. For example, the case instruction may be, Joe is 20 years old and is a new patient to the practice. You do not know why they have presented. If there are any concerning features in the history, you should highlight them on your front page. This will remind you to discuss them during the rest of the case. It may also help direct you towards a diagnosis or management. Concerning features in the history would include smoking, unsafe alcohol use, recreational drug use, poor diet, being overweight or obese, poor exercise levels, symptoms of stress, anxiety or depression, unsafe sex practices, medication compliance issues or medication side effects, unexplained weight loss, and a change in bowel habit. I recommend practicing your history using a timer. See what you can cover in 2.5 to 3 minutes. There are 2 things I recommend asking in each case. Has there been any recent overseas travel? And do they identify as Aboriginal or Torres Strait Islander? Both of these can impact on your overall management and increase the likelihood of some diagnoses. I would suggest that you develop a set of questions you ask every time in a set order so that you can cover all of the significant history quickly. You can then expand on these or ask case-specific questions. You can ask for both personal and family history at the same time. For example, have you or anyone in your family ever had diabetes? This can save you some time, which can be used elsewhere. You can always go back and ask for further history later in the case if you have forgotten something significant. An important thing to remember is that even though OSCEs are time sensitive, it is still important to take time to introduce yourself, listen to the patient, and be empathic. Each case can be different, but in most cases, when you introduce yourself and ask, "What can I do for you today?" the examiner will have a scripted response that you should not interrupt, as it may give you some direction on where the consultation will go. Communication is an important part of the OSCE process and is one of the domains you will be assessed on. Every OSCE will be different as to what observations are required, if any, and also how the results will be given to you. You may have to ask for each individual one, or you may be given a summary sheet with all of the observations provided once you ask for them. If the case instructions say no further investigations or examination is required, you should have crossed those sections off your front page. Do not waste time on things that won't get you marks. The amount of time spent on this section will also vary depending on whether it is a short or a long case, and how many other components are required in the case. As you did with the history, practice timing how long it takes you to do the observations. You should be able to ask for them rapidly. It is obvious to the examiners which candidates have a system and have practiced using it. I recommend having a set of routine bedside examinations and observations that you ask for in each case. If they are not required, the examiner will tell you. My list is general appearance, BMI, height, weight, waist circumference, blood pressure and pulse, temperature, respiratory rate and effort, oxygen saturations, urinalysis, blood glucose level, ECG, and spirometry. Any abnormal observations provided would be expected to be recognised and commented on during the case. They may lead you towards a diagnosis or a more focused examination and investigation. As with the previous categories, the examination varies from case to case. It could be an examination OSCE where that is all you're required to do. It could be a case where no examination is required, or a focused examination as part of a larger case. You are expected to wash your hands prior to touching the patient, or at least state you would like to wash your hands if it is a virtual or a no-touch examination. As with observations, the way you are given the examination results will vary. You may have to ask for each specific result, or you may be given a sheet with all of the result findings. In a short case, you will not have time to do a full examination. In most cases, you will have to do a focused, system-targeted examination relative to your case. With investigations, you can ask for whatever investigations you want. Unlike the AKT and KFP exams, you will not be penalised for asking for extra investigations. You should have a list of standard investigations you ask for in most cases, and then add whatever is relevant for your case. Always think about the 7 masquerades when deciding on what investigations you ask for. Some OSCEs will be a single consultation. The results of any investigations may not be available. In this case, you would be expected to list what tests you would like to perform. OSCEs that are conducted over a number of consultations give you the opportunity to request investigations and then get the patient back to give them the results. This can take a bit of getting used to. Consider doing additional tests like GCS, mini mental state exam, Edinburgh postnatal depression score, mental health screens, alcohol use screening tools. Consider referral for specialised investigations like 24-hour blood pressure monitors, sleep studies, stress echoes, endoscopy, or even a functional driving assessment if relevant. Make sure you have read the case instructions carefully. I run a lot of OSCE practice sessions in my practice, and the registrars regularly forget what the instructions were mid-case. Some concerning feedback I have had from recent OSCEs is that not all the results were given to the candidates when they were given a result sheet. If you expected or wanted an additional result, it is worth asking for it. If it is not required or not available, the examiner will tell you. Some OSCEs will want you to give a diagnosis, or at least a differential diagnosis. Other cases may not require a diagnosis. A different version is where you are given a diagnosis and have to explain this to the patient and discuss management. You may also be given an ECG to interpret. Always consider the serious conditions not to be missed, like pulmonary embolus, myocardial infarction, an acute abdomen, or an ectopic pregnancy. If you are uncertain of the diagnosis, I reckon committing to the most likely diagnosis. If you do this, make sure you safety net them in case they do not improve. You could explain that your diagnosis is not certain and give a differential diagnosis instead. As with diagnosis, you are best to commit to a management plan. Make sure you safety net them and arrange a follow-up appointment if required. If the case has a condition that could affect their ability to drive, discuss the driving implications. If it is an elderly or infirm patient, then consider home help, meals on wheels, or even carer respite. If there is a risk of falls, consider a formal falls assessment and management. Consider whether care plans are required. Always think, could this be a medication compliance issue or a medication side effect? Ask for a home medicine review if appropriate. Consider safety elements. If there are mental health issues, do a risk assessment for suicidal ideation, thoughts of self-harm or harm to others. Where appropriate, refer to a psychologist or psychiatrist. Ensure they have adequate supports and whether they are safe to be managed in the community. If there are concerns for domestic violence or child abuse, Refer them to the relevant state authorities or police. Ensure they have adequate supports and ensure it is safe for them to return home. Any significant findings during the case should be addressed. You should identify and mention them in your management. It may not be possible to cover all of these at the initial consultation. You can tell the patient or examiner that you would like to get them back for a longer consultation to discuss any issues not covered today. Lifestyle modifications are important to address. Smoking cessation, safe alcohol consumption, improving diet and exercise, and safe sex practices. It is better to list all of the management items at the start than expand on the more important components. If you have time, go back and expand on the other items. The two most important things in OSCEs are time management and making sure that you read the case instructions carefully. As an examiner, it is hard to watch candidates who have not understood the instructions or waste time doing things which are not required and then run out of time. Remember, you do not have to pass every case. If you have a difficult case, do not let it throw you, just put it behind you and move on to the next case. The OSCE day is a long and stressful one. Most people will struggle with a few cases. I find the OSCE exam is the fairest of the three exams and is meant to represent a day in general practice. Thanks for listening. Subscribe to the OSCE course and I will help you pass the OSCEs. Have a look at our other exam preparation products at GP Core Content. See you next time.